Welcome to your joint replacement class. My name is Alberta Burtonshaw. I am the nurse manager of the Joint Replacement Center. I have been a registered nurse at Stillwater Medical Center for over 14 years now, working with patients who have had joint replacement surgery. This class is designed to help prepare you and your family for your upcoming surgery. This class will be about an hour and 15 minutes long. I'll be covering most of what is in your education manual that you got at your surgeon's clinic. Unfortunately, I cannot cover all the information, so please, before you come for your surgery, I need for you to read the entire book. It has very important information in it that will help you through your recovery process. Okay, before I get started, I do want to thank you for choosing Stillwater Medical Center. It is an honor that you put your trust in us to help you with your surgical needs, and we are going to take excellent care of you. Okay, let's get started. You have a very large team on your side helping make sure that your recovery process goes as planned. As your nurse manager, I will come visit you every day that you're in the hospital. I will make sure that you do not have any concerns, and if you do, I will help resolve those. I work with your nurses, your doctors, the whole team to make sure that your recovery process goes as smooth as possible. And of course, we really hope that you can have a coach on your side. This is someone that you select, a family member, a friend, someone you go to church with. This person will be very important to you. They will help take care of you when you get home from the hospital. There are some things that you might not be able to do. So it's important that you have someone stay with you at least the first night or two. And of course, you have your surgeon and your surgical team. We have Dr. Payton, Dr. Wooler, Dr. Jameson, and Dr. Stubbs. They have all worked together for many years now doing joint replacement surgeries. Your registered nurses that we have on staff, they have been specifically trained to work with people having joint replacement surgery. So we are going to take great care of you. You will meet all of these, most of these people while you're here if you need to. And of course, we have the very important physical and occupational therapists, and they will help you meet your goals so you can get home in a timely manner and have a safe recovery. If you'd like to follow along in your book, I did put the page number on the slides that correspond with the manual. And we all care. Our goals for you is for you to understand your disease process and the surgery. We want you to feel comfortable about this joint replacement experience you're about to have. Our program is designed for you to return home within 2 to 3 days. We want to answer all your questions, so please, after you hear this video, if you have any questions at all, call me. My number is in the back of the book, and I will answer all your questions. And we're going to try to have fun in the process. And I know when you're thinking about a serious major surgery like this, you're not thinking that you're going to have any fun. But we do try and add some fun. Laughter is good medicine, so we try and have as much fun as possible. I want to touch a little bit on joint disease. If it wasn't for joint disease, you wouldn't be facing a joint replacement surgery. Osteoarthritis is the most common form of joint disease. Nearly 52 million people in the United States alone suffers from osteoarthritis. This is a disease of your cartilage. It breaks the cartilage down. The cartilage is the rubbery material that covers the ends of your bones. It helps your joint move smoothly, and it also helps as a shock absorber. Well, with osteoarthritis, the cartilage starts breaking down. And unfortunately, once cartilage is gone, it cannot regenerate itself. So it's a progressive disease. Over time, that cartilage just gets thinner and thinner until it can no longer do its job, and then your basically bone on bone and you're facing a complete joint failure. And that's probably where you are if you're having a knee replacement surgery. And of course, unfortunately, there is no cure available for osteoarthritis. Some of the risks are genetics play a part. If it runs in your family, you're more at risk of getting it. Females tend to get it more often than males. Obesity does play a part. The more stress we put on those major joints, the faster that osteoarthritis can wear out that cartilage. If you've had any prior injuries or fractures, if you've had surgeries on that joint, or if you've had a job or a sport that just caused repetitive stress to that joint, it can cause osteoarthritis. I'm going to talk about the knee replacement surgery first, and then I will talk about the hip replacement surgery. So in this diagram here, this is a very healthy knee joint. Your knee joint is a hinged joint, and it's made up of your femur, which is your thigh bone, the tibia, which is your shin bone, and your patella, which is your kneecap. So as you can see in the diagram, the white material that's covering the ends of the bone, that is your cartilage. And that's very healthy. Over here in this diagram is a very diseased joint. The cartilage is worn away. You can see bone. The bone is so damaged that it's starting to grow little bony spurs. This is a completely failed joint now, and it needs to be replaced. So what happens in surgery? So once you are completely asleep, the surgeon is going to put your foot into a boot to open up that joint. And the first things they're going to do is take all that old cartilage off the ends of your bones. So all that arthritis is going to go away. You will no longer have arthritis in that joint. So they clean it off, make it all pretty. They're going to reshape the end of that bone. And I'm using the femur bone right now. This is your thigh bone. This is what the prosthesis looks like for your femur. And you want to notice the shape of it. That is the shape that they're going to make the end of your bone. It does have a couple of pinheads, and they will drill a couple of small holes in the condyles of that bone. And then they will glue it into place with a special surgery glue. And that's what your femur will look like. Now for the tibia part of your joint, they're just going to shave that bone flat and take that old cartilage off. And this is what the prosthesis looks like that goes on your tibia. It does have a pretty long shaft there. They will drill down into that bone, and then they will fit that prosthesis into place. This will not be a metal-on-metal prosthesis. They will put a polyethylene liner in place so that when you use your joint, it will glide very smoothly. The spacer will act a little bit like your cartilage, but it will not be a shock absorber. So it's important that you're not doing any high-impact sports after your surgery. Now, as far as your kneecap, they will resurface the underside of that and put a polyethylene button on the back of it. And so when you're all back together, your patella, your kneecap, will glide smoothly in the groove of that joint. Now, this prosthesis is made out of titanium. Titanium is a very porous metal. When your bone heals from this surgery, it will grow little bony growths into those tiny pores, and it will help make it a very tight fit. So that is basically what happens in a total knee replacement. Now, some people only need half of their knee replaced, and that is what is called a partial knee replacement. And it's much like the total, where they're going to be opening up that knee, and typically it's the inside part of your knee that needs to be replaced. And so the surgeon will clean off that old cartilage from that side. They have lots of specialized tools to do that. This is the prosthesis for your femur. It's very small compared to the total. It has a couple of pins there, and then they will drill a couple of holes. Let me see if I can get this. And it will be glued into place, like so. And then for the tibia part of that joint, they will shave it flat, just like similar to the total, except we're only using half the knee. There's a little lip there, so there'll be a little groove, and they will glue that into place. Of course, your surgeon is much better at this than me. And that goes there, and then there will be a spacer, so it will not be metal on metal. So that is a partial knee replacement. Now, because this is a lot faster recovery, you will be an outpatient with us, and you will only be staying one night if you are having a partial knee replacement. This is a picture of what the prosthesis looks like in an x-ray. All right, I'm moving on to the hip replacement. So the hip joint is a ball and socket type joint. It consists of the upper part of your femur and your pelvis, just like that. It's a ball and socket. The ball is the femoral head, and the socket part of your joint is called the acetabulum. Okay? When you're in surgery and you are completely asleep, your surgeon is going to lay you on your side. You're going to be on the side because they do what is called a posterior approach to the surgery. Your incision is going to be back here. They will need to dislocate your hip, of course, to do the surgery. They'll dislocate the hip. For the femur, they are just going to cut the ball off. That goes away. All that arthritis is gone. This is what the prosthesis looks like for your femur. It has a pretty long shaft, and then it has the ball. This is also made out of titanium, just like the knee prosthesis. So when you heal up, it will grow into those little pores. They do have specialized tools that will drill down into your bone so that it will accept that prosthesis. Now for the socket part of your joint, he's going to clean all that old cartilage out, make it all pretty, and place a cup, which is also made out of titanium, into that pelvis. There is a polyethylene liner, and when you're all back together, that's how, well, I don't know if I've got that straight, but anyway, this is what your hip will look like, and it will work great. That is a total hip replacement, and this is an x-ray of it right over there. Okay, we're going to move on. There are risks involved in having joint replacement surgery. There's risk involved in any type of surgery that you have. The two risks that I want to talk about right now are blood clots and infection. There are more risk factors described in your book, so please read those over. You are at increased risk of getting a blood clot, so we do a lot of things to help prevent that from happening. Right out of surgery, you will be given these TED hose. There will be typically one on your non-surgical leg, and typically you'll have an ACE wrap on the surgical leg because it has a big dressing on it. But before you leave the hospital, you will be wearing both TED hose on both legs, and that helps to keep the blood from pooling. It just keeps your circulation going. They're compression hose. You will be wearing these for 4 to 6 weeks after surgery because that's how long you're at increased risk for developing a blood clot. While you're in the hospital, we will be putting these compression devices on your legs. This is the calf style. It'll go around your leg. There is a pump at the end of your bed, and it's going to pump up and massage your legs and keep that blood moving. This is the calf, and we also have a foot type style that just goes on your foot. And it'll just depend on which one your surgeon orders for you. Your surgeon will also put you on a blood thinner. Typically, it's a full dose aspirin. But if you are taking blood thinners for another health condition, then you will most likely restart that blood thinner after surgery. We do a lot of activities after surgery. You are most at risk when you are sitting or laying and not doing anything. So we are going to keep you very active while you're here at the hospital, and we want you to continue that once you get home. Infection. We all know now that washing our hands is the #1 way to prevent infection. If there's anything COVID has taught us is that we need to wash our hands frequently during the day. So anyone that comes in your room, anyone that you are interacting with, they need to be washing their hands. Your surgeon is going to be giving you an antibiotic while you're here at the hospital. You'll get 3 doses. The first one you'll get right before you go into surgery, and then you'll get 2 more doses. You will not need to have any antibiotic when you get home. Your surgeon will put a dressing on that incision before you leave the OR, and that will stay on until you leave the hospital, and then it'll be replaced by a waterproof dressing that you will keep on until your follow-up appointment. You will not need to change it or do anything with it, and you can shower with it on. So it's a very good dressing. If you are a smoker, I very much encourage you to stop smoking or at least reduce it as much as you can. That does impede healing, and as the longer it takes that incision to heal, the more at risk you are of getting an infection. In the same way with our diabetics, you have to be controlling those blood sugars so that your incision will heal as fast and as well as possible. You do need to get registered before your surgery. You need to get registered. You're going to be meeting with a pre-surgery nurse, and you need to get your lab tests and your imaging done. You should have an appointment already made to have those things done. So please make sure you make that appointment. In the pre-surgery interview, your nurse is going to ask you about your allergies, especially if you're allergic to metals. We need to know that. If you've had any previous surgeries, we need a list of your medications. So either bring a complete list with your prescriptions and your supplements, any over-the-counter medications. Bring a list, or you can just bring all the bottles with you. If you have other health conditions, you might need to get a clearance from your cardiologist or your primary care physician saying that you are okay to have surgery. So the pre-surgery nurse is going to look at your medications, and she's going to tell you what medications you need to stop before surgery. There's some that you need to stop early. She's also going to tell you what medications you can take the morning of surgery. Make sure you are writing this down, because the morning of surgery, you're going to have a lot going on in your head, and you might forget what she said. If you take a medication that you were not supposed to take, it can cancel your surgery. So be sure you understand what medications to take and which ones not to take. Okay, a little bit more on preventing site infection. We just don't want you to shave your legs. It can cause little cuts. We just don't do it. We do have some pre-surgery bathing that we need for you to do. You should have gotten a bottle of Hibiclens. This is given to you at your pre-surgery visit. So you're going to be using this the night before you come for surgery. You're going to wash from the neck down, use half the bottle. You're just going to wash from the neck down and rinse it really, really well. After you bathe, don't put any lotions, powder, nothing goes on that surgical leg. What to bring to the hospital? You want to bring clean, comfortable clothes. We are getting dressed every day that you're here. We're not staying in the hospital gowns. We want you to wear shoes. They need to be flat, rubber bottom shoes that support your foot very well. Bring your hygiene products. If you forget something, we have stuff here. Bring your education manual. We do use that while you're here. It's very helpful. Bring your medications and your supplements, and they need to be in the original prescription bottles. And if you use a CPAP at home, please bring it. Bring your CPAP and your mask with you. You need to have it here after surgery. So let's just recap a little bit. The night before surgery, before you go to bed, you're taking that first shower with that special cleanser. Get a good night's sleep, but don't eat anything or drink anything after midnight. And when we say that, we mean nothing. Nothing goes in your mouth. You can't have ice chips, gum, mint, nothing in your mouth after midnight. In the morning, you're getting up pretty early probably. You're going to take that second shower. You need to take 2 showers with this cleanser. From the neck down, wash your body again. It's okay for you to brush your teeth, but don't swallow the toothpaste water. You may need to take a medication that morning. Take it with the smallest sip of water. Put on some clean, comfortable clothes. Leave your money and jewelry at home. You don't want to have something come missing. It all needs to come off for surgery, so just leave it at home. And please do not wear nail polish if at all possible. We have sensors that we need to use for oxygen, and it's difficult when you have nail polish on. So then you're arriving to the hospital. A staff member from the hospital should be calling you the day before to tell you what time to get to the hospital, okay? If you have an early surgery, if you're coming to the hospital before 7 a.m., you need to use the main entrance. After 7, you're able to use the east entrance where all the construction is. And then you're going to be checking into the surgery waiting area. You'll receive an identification bracelet. Make sure that's you and your date of birth. Your nurse will call you and take you to a holding room where she's going to prepare you for surgery. You can have one person go back there with you. And of course, they have to wear a mask. Once that surgery nurse has gotten you ready for surgery, then your family will come up to the Joint Replacement Center and wait for you in your room. So the nurse is going to prepare you for surgery. There's a lot of things she has to do. She has to give you that first dose of antibiotic, which goes into an IV. You have to get into a surgical gown and all this stuff. Your surgeon is going to visit you in that holding room, and you can ask those last-minute questions that you might have. The consents need to be signed, of course, and your anesthesia provider is going to come visit you and talk to you about your anesthesia options. I'm going to talk to you a little bit about them. I want you to know the basics about the 2 types that we do here. We do spinal and we do general. So a spinal anesthesia is where they're going to inject, the anesthesiologist is going to inject a medication in the lower part of your back. That medication will make you numb from the waist down. It will last about 4 hours, the numbness. The anesthesiologist will stay with you, and he or she will put medication into your IV so that you're asleep during the surgery. It doesn't take much medication to do a spinal anesthesia. So you're less likely to have side effects from the medication. And one of the really nice benefits of a spinal is that the spinal lasts about 4 hours. Your surgery lasts about 2 hours. So right after surgery, you are feeling no pain in that new hip or knee. And it wears off gradually. So as soon as you feel the slightest discomfort in that joint, your nurse can start your pain management, and we can keep your pain under control. It's very nice. And you don't have that real groggy feeling that you can get from a general anesthesia. But not everyone is a candidate for a spinal. If you've have had back surgeries, fusions, if you've had heart valve replacements, you're not a candidate, and we just can't do a spinal. So we do a general. A general anesthesia is where you're 100% knocked out. You are so sedated that you do have to have a tube down your throat to help you breathe. It takes a lot of medication to get you that sedated. So we find that our patients who have a general tend to have more side effects like nausea, vomiting. You just feel foggy-headed. You may lose your appetite. And those feelings might last for the first day. But it wears off, and the nurses are very good at giving you medications to help with the nausea. Your anesthesia provider has so much more information to give you on these types of anesthesia, so please have your questions ready, and they'll be happy to give you more information. So after your surgery, you're going to be coming up to the 5th floor. That's where our joint replacement center is. All of our rooms are private. Your family will be waiting for you there. And of course, we are a non-smoking facility. And what to expect? When you first get up here, there's going to be a lot of staff in your room. We are doing lots of assessments. We're monitoring your blood pressure, your oxygen. We're making sure you're not having any adverse effects from your surgery. Most of our patients do come back from surgery with a urinary catheter placed. You are not ready to start getting up and going into the bathroom. So typically we leave the urinary catheter in until the next morning. We do start ice. Ice is very important after surgery. This will help with pain control, and it also helps with swelling. Our knee patients do have a lot of swelling after surgery, and our hip patients will have a little bit too. But we will, this will be your ice pack system to take home with you so you can continue your ice at home. And we will teach you all about it once you're here. Okay, we will put your compression devices on like we talked about earlier. Your surgical leg needs to be elevated. That helps with your swelling. Our patients having knee replacement, it's another benefit of elevating that leg is to help achieve a straight leg. That's one of your most important goals after surgery, is to get a straight leg again. And keeping that leg up on a towel roll or a pillow will help gravity bring that knee back where it belongs. Now, our patients having hip replacement surgery, you will have a pillow between your legs. One of your precautions after surgery is that you do not cross your surgical leg towards the midline of your body. You do not want to cross over, because you will be at risk for dislocating that new hip. We start your pain management as soon as we can, as soon as you need it. We will start your pain management, and you start eating some ice chips, drink a little water, and if you're not nauseated, you can order a sandwich or something to eat. Managing your pain. This is a big part of your recovery process. We want to keep you as comfortable as possible. We cannot take your pain 100% away, but we can keep it tolerable for you. We use the Wong-Baker pain rating scale. You'll be asked this many times while you're here at the hospital. Rate your pain between 0 and 10, where 0 is no pain and 10 is the worst pain you've ever felt in your life. Well, of course, if you've had a spinal anesthesia, you're going to have that happy face when you get back from surgery. But unfortunately, it doesn't last long. All good things come to an end. So what we ask our patients is you've got to talk to your nurses. When you feel like your pain is getting to a 2 to a 4, you've got to tell your nurses so they can bring you in some pain medicine. If you wait till your pain is in the upper numbers, an 8, it will be very difficult to get it back down. So taking pain medicine on a regular basis is key to a successful recovery. The importance of pain control. Your body is going to be more relaxed and you're going to heal more effectively. You're going to be more active, you're going to be able to participate in physical therapy, and you're going to have a more successful recovery period. Another risk from having surgery, and this is any kind of surgery that you may have, is developing a lung infection. So after surgery, the respiratory therapist is going to come in your room and teach you how to use this incentive spirometer. This helps get your lungs back inflated, especially if you've had a general anesthesia. Your lungs tend to flatten out. So this machine, these deep breathing exercises will help re-expand your lungs and keep fluid from building up in there and causing an infection. So you will be doing breathing exercises after surgery. This is a very aggressive program that your surgeon has put you in. We are going to be getting you up approximately 3 to 4 hours after surgery. The physical therapist will come to your room. If your legs are awake and you're feeling good, they're going to sit you up at the edge of the bed. And if that goes well and you feel fine, they're going to have you stand up. And if that goes well, they will take you for a walk. The majority of our patients do walk in the hall about 4 hours after surgery, and it's a wonderful, wonderful thing. We do have a set of hourly exercises that will be posted in your room, and we will, if you want a great recovery and if you want that joint to work as well as it can, then these hourly exercises are very important, and we encourage you to do them every hour. If the physical therapist is not available, if you have a late afternoon surgery, the nursing staff is very well trained. They will get you out of bed and they will take you for your first walk. So hopefully you'll get a good night's sleep that first night with us. Your day is going to start very early the next morning. If you still have that urinary catheter in place, that's being removed. It is time for you to start getting up and going into the bathroom just like you do at home. You'll get a little sponge bath. We will get dressed in our normal clothes. You'll be up in the chair for all meals. You will be very active just like you would be at home. And group therapy begins on this day. On the second day, if you like to have a shower, we'll help you in the shower. You'll again be up in the chair, doing your exercises, staying active, and go to group therapy again. In group therapy, this is where we try and have some of our fun. It is a Western theme. You're going to the Western Roundup. So typically, we will have a 9:30 group therapy, and we do encourage that you bring your coach and let them join in. So the morning therapy is at 9:30 and typically the afternoon is at 1:30. But this is where the physical therapist and the occupational therapist will work with you and show you how to be safe, help you meet those goals that you need in order to go home and have a safe recovery. Your goal is to be walking 200 feet before you leave our hospital. Probably 80% of our patients are walking 300 feet or more. So it's very achievable. We have a great staff here that will help you achieve that goal. You do need someone to drive you home, so please make sure you have a driver. When you are traveling, you need to be careful about developing a blood clot while you're traveling for long distances. So be sure you're moving those legs and get out of the car periodically to walk around. All of our patients need outpatient physical therapy when you go home. So if you need to start thinking about this, if you don't know of a place that you can go, I will be calling you very soon. I will talk to you about your options for physical therapy, and I'll make that first appointment for you. Typically, you will be going 2 to 3 times a week for 4 to 6 weeks. It just depends on how fast you progress in your recovery. While you're at home, you need to continue those exercises that we were doing here in the hospital. That's how you're going to get a great working joint. You have to put the work into it. Check your insurance, please. Things change all the time with insurance policies. It's probably just fine, but it doesn't hurt to double check to see what your insurance covers as far as physical therapy. That's the end of my portion. I'm going to hand it over to our occupational therapist. She's going to talk to you about safety in the home.
Hello, my name is Ashley, and I'm the occupational therapist here at the Joint Replacement Center. I'm going to be talking to you a little bit today about keeping your home safe and making sure that you don't have any issues whenever you do go home. When we're preparing to go home, we want to make sure that you're thinking about your safety. Whenever you have your walker or you're getting used to that new knee or hip joint, you want to make sure that you're removing things and getting them out of the way, like throw rugs or electrical cords. You want to make sure that you don't have tripping hazards within your home. You want to make sure that you have good lighting throughout your home. Install night lights if you need them, especially through frequently traveled areas. For those of you that get up in the middle of the night to use the restroom, that's really important. Or at least make a little night light path for yourself towards a light switch so that you can get there safely and illuminate the rest of the room. You want to start thinking about some non-slip mats for your tub or shower. That'll be really important. The bathroom environment is one of the most accident-prone places in your home because it's a wet, slippery environment. You want to make sure that the floor outside your shower or tub is nice and dry, have plenty of towels. You want to make sure that if you need to stand up within your tub or shower, that you have a nice grippy surface to stand on. Make sure that any stairs within your home or outside of the home have handrails or something very supportive for you to put weight on should you need it. And you also want to take a look at your toilet height as well. If your bathroom toilet is too low, it could be very difficult for you to get up and stand. So you might think of something like a toilet riser, which sits on top of the toilet and attaches to the bowl and makes that height a little bit greater for you so that you can have an easier time standing up. You want to make sure that your coach, spouse, or family member should stay with you that first night to make sure everything goes pretty smoothly and that you're safe within the home at all times. So these are the front-wheeled walkers. I really prefer these walkers to, say, a 4-wheeled walker or a 3-wheeled walker. They're very stable as you move through your home environment or in the community, and they still allow freedom of movement as you walk along. Some tools that we have for the bathroom here, you'll notice that in the upper left-hand corner, there's a tub shower combo bench. That's really beneficial for if you have the tub shower combo. It actually sits over the top of the edge of the tub. 2 legs are on the outside, 2 legs are on the inside, and you can adjust the leg height to make it easier for you to sit down and stand up from. You sit on it on the outside of the tub, and then you swing your legs over into the tub. If you have a hip replacement, you want to make sure that you're still abiding by those hip precautions, so whenever you're on that tub transfer bench, you lean back a little bit to accommodate for that angle that you need to keep. You don't want to be too far forward because that puts you at bending at 90 degrees or greater, and we don't want that. We want you to stay more open through that angle. So leaning back to swing your legs over is really beneficial for the tub transfer bench. The next one in the upper right-hand corner is the shower chair. This is just a simple chair that sits in a walk-in shower. You take the walker into the shower with you if you can, or use grab bars that are placed within the shower to hang on. And then you just sit down like you would a normal chair. And both of these options have handles on them. Some options don't. Take that into consideration when you're thinking about that purchase. These options also both have backrests on them, which I personally recommend as they increase the safety that you have within the shower. But on the lower level here, you'll see some options for some toilet adaptations. You have some toilet risers and some handles that remain on the toilet. That way you can get up and get down from the toilet easily. This package here is called a hip kit. This is very beneficial, and we highly recommend people with hip replacements get the hip kit. You have hip precautions when you come out of your surgery. That is no bending past 90 degrees, no twisting your feet inward or crossing your legs over. And abiding by those rules can be very difficult if you're trying to dress yourself or shower yourself. So these are some tools in this kit that help you do that without breaking those precautions. The first one is a long-handled reacher, or some people know it as a grabber. It's basically a claw that extends, and you can squeeze the lever to pick stuff up off the ground so that you don't have to bend over and grab it. It can also be used for dressing and things like that. You also have a long-handled shoe horn. This is to help you kind of hold the back of your shoe back so that when you slide your foot in, you don't have to bend down to put your fingers at the back of your shoe to get your heel in. You have a long-handled sponge, and you've probably seen these at Walmart or Dollar General. It's basically just a sponge that's a little bit longer, so you don't have to bend down or bring your legs up to you to wash your legs and feet. You have a long-handled dressing stick, which is very beneficial for, again, dressing. And then you have a sock aid or a sock donner. Again, it helps you put your socks on your feet without you having to bend over. The reason it's really important for you to abide by your hip precautions is because when the surgeon goes in, they have to maneuver and manipulate your hip joint so that it dislocates. They have to move muscle out of the way, they have to cut through some tissue, and that puts you at an increased risk of having that hip dislocation occur again if you don't abide by the hip precautions. Once again, those hip precautions are you want to limit your hip flexion to no greater than 90 degrees. So that includes bending down to pick something up or bringing your leg up to you past 90 degrees. You don't want to cross your legs. Crossing your legs, even at the knee or the ankle, is a no-go right now. You don't want to turn your legs inwards, or as I like to say, no toes turned inwards. This movement is the same movement that the surgeon used to help dislocate your hip, and that's why it's important for you to abide by your hip precautions. Next up, I have Kaylee, our physical therapist here at the Joint Replacement Center, to talk to you about some exercises that she'd like for you to complete.
Hi, my name's Kaylee Dunlap. I'm one of the physical therapists here at Stillwater Medical Center. I've been a therapist for 12 years and worked up here over the past 7 years, so I've been here basically since 2013. Today we're going to talk about the exercises that are really important to continue to do prior to your surgery. All of these are going to help you recover so much quicker. Studies show that you can shave off about 2 to 3 weeks of your recovery if you do these simple range of motion and flexibility exercises. So to me, if I can get better in 2 to 3 weeks, I'm going to do it. So we're going to start off with some butt squeezes. You might think, why do I need to squeeze my bottom? Well, we sit on it most of the day. Those butt muscles get really stretched out, and we need to tighten them so that they actually do their job. Their job is to actually keep you in an upright posture whenever you are standing and walking. They kick in to stabilize your pelvis. So we want you to do these butt squeezes to get those nice and tight so you can stand in the best posture whenever you're rehabilitating. So you're going to hold for about 5 to 10 seconds, and you can do anywhere between 10 to 20 reps of these. But I tell you, even if you have a little bit of pain because of your joint that needs to be replaced, even if you do 5 to 10, that's better than nothing. So the next thing we're going to talk about is what's called a quad set. Quad is just a fancy way to say 4. 4 muscles cross this joint and that's why they call it the quad. It is the top thigh muscle. What you're going to want to do is tighten and push your knee down and hold. Again, 5 to 10 seconds, just like that glute set, but this time we're doing the quad set. This exercise is very important because whenever they go in, especially with the knee replacement, they move that muscle out away and they stretch it. Whenever they stretch it, it cannot do its job, which is to straighten your knee. So you need to keep it tight, just like our bottom squeezes, so that it can help straighten your knee when you want to use it after surgery. The next exercise we're going to talk about is on the back of the thigh, the hamstring set. So a lot of times we're really tight in these muscles, but we're not very strong because they don't work a ton in our day-to-day exercises. They gently bend our knee when we're walking. So you're going to want to keep that strong so you can gently bend your knee when you're walking. In order to do that, you're going to dig your heel into the ground and feel the back thigh muscle kick in. Again, holding 5 to 10 seconds, 5 to 20 reps, whatever feels good to you. The next exercise is going to be the single or straight leg raise. That is, again, tightening that quad, and you're going to lift up and down. That's a similar motion if you were standing of taking a step. It's also that first initiation of getting out of bed. So it's a very important muscle to keep strong, whether you're having your knee or your hip replaced. The next one is called hip abduction. A lot of people say, well, what does abduction mean? Well, if you abduct something, you take it away, right? So with the hip abduction, we are taking our leg away from our body. That is important. Again, bed mobility, moving your leg to the side. So we're going to keep this muscle right here nice and stretched. We're going to keep this one nice and strong. So again, 10 to 15 reps, whatever you can tolerate. Now we're moving on to arm exercises. You might think we're crazy, but you are actually going to use your arms a lot in your recovery. When you are bracing yourself, when you're pushing yourself up to stand, when you're helping to guard that new joint and take some of the weight off of it, you're going to rely on your arms a lot. So we added some arm exercises because we got feedback in previous years that patients literally said, I wish my arms would have been stronger. I wish you would have done this. So you can thank previous patients for the next few exercises. You are going to start with some chair push-ups. Now, if you have some shoulder issues, I'm going to show you an exercise later on that you can do to work this same muscle without as much of your weight going through. But what you're going to do in a sturdy kitchen chair, which by the way is what I recommend you do all of these exercises in, you're going to push up and down. Again, that's that first motion of standing up. So you are going to work that tricep muscle to help you stand up. The next ones are bicep curls or elbow flexion. You do not need to run out and buy a pair of weights. You can get a water bottle. You can get a can of corn. Ladies, a lot of your purses weigh about this. So just grab something, a Walmart sack full of something, and you're literally just going to flex your elbow up and down. This also helps you, if you have a grab bar, you're going to pull yourself up. That's the biceps, so that's why we're wanting to keep that muscle strong. The next one, tricep extension. Again, I said that chair push-up. If that's too much on your shoulder, what you can do is you can find you a nice sturdy spot. You're going to take your arm like this, and you're just going to straighten it. So that's that same muscle, that push of the chair, but you're just doing it with less of your body weight through it. So that's just an alternative to keep that tricep strong. The next one, if you remember the hip abduction, taking our leg away from our body, is shoulder abduction. So I'm taking my shoulders out and away from my body. So it's kind of like snow angels, if you will, if you want to do both of them at the same time. And then you have shoulder flexion. It's just a different plane of motion, but you can pick anywhere in between it if you have shoulder issues. Whatever works for you, just make it work. My little, I guess, public service announcement, whenever you are doing these shoulder exercises, anytime that you are raising your arm above you, you want to lead with your thumbs up. If you do not, and you might say, well, I always do that. Not always. A lot of people will paint their walls and they're doing this with their thumb down. they will sweep or rake, and it's this way. You are jamming that muscle into your joint surface right there. You are going to create inflammation or frozen shoulder. It's just not fun. But as soon as you rotate and do thumbs up, you clear that joint and you're good to go. So just consider when you're doing things around your home, thumbs are always up. So thank you. We know that you're going to do very well. I'm going to hand it over to Alberta again, and she's going to close up the class.
Okay, there's just a couple of more things I want to talk to you about. Yes, we do need to pay attention to the coronavirus. It's still here. We're still doing our safety measures. So we are wearing masks. They are mandatory in the hospital. Your support person needs to be wearing a mask. We're doing cleaning of every item after each use. We're using special cleansers to make sure that they are cleaned properly. When you do wash your hands, please be sure you're washing them for 20 seconds. That's how long it takes to get the germs off your hands. And when you are in a group setting, please be aware of your social distancing. Stay 6 feet apart. Try not to get out in the public right now. Try and quarantine at home. We don't want you to go to Walmart and catch this virus right before you go have surgery. So please do your part, keep yourself safe and your family safe. There are some important numbers in the back of your book. I just wanted to point that out. Please give me a call if you have any questions. I will be calling you very soon in the next few days. I will talk to you about that outpatient physical therapy appointment, and I also will talk to you about getting a walker that you will need to use at home. You won't need to use it very long, but you will definitely need to have a walker. So we thank you again for choosing Stillwater Medical Center, and I look forward to meeting you on your surgery day. So until then, good luck, and we'll see you soon.